Thanks for staying tuned to Channels Television. Welcome to Health Matters. I'm Yomi Otaigbe. Today on the program, we'll be talking about two medical conditions that sometimes form unholy alliance, creeping in on people, and I'm talking about hypertension and diabetes. We'll be talking all about what causes hypertension and, of course, how to manage and prevent it. To tell us everything, I have with me in the studio a family health physician who is also the special advisor to the Lagos State Governor on Health, Dr. Yewande Adesina. Thank you for joining us.
Thanks for having me. Good morning.
Okay, hypertension, diabetes. Tell us about this twin condition.
Actually, the triplets. There's hypertension, there's diabetes, and there's dyslipidemia, which is a cholesterol problem, but it's not as prevalent as the other two.
Definitely it's not the kind of triplets that we want.
No, not the kind of triplets, and even the hypertension, diabetes are not the kind of twins that we want. Neither do we want any one of them in our health status. Hypertension is a medical term for high blood pressure, and high blood pressure, like the name connotes, means the pressure in the body is high. That is, the blood circulation system has a high pressure. I always explain it by using the pump and the pipe. The pump, imagine a water pump, and the hose coming from the pump right back into the pump with no taps or outlet. So it's pumping in a closed system. And excuse me, in the closed system, you have little balloons that are shooting off, like the brain, the kidneys, the heart, and the eyes. They are end organs. They stand alone. There's nothing going to them and then exiting on the other side of them. So the blood goes in and does a U-turn and comes out back into the hose. If the pump is pressured and is high in its pumping capacity, it transfers the pressure into the hose. And those little end organs absorb a lot of more pressure to try and balance the pressure in the hose. Now, when the pressure gets too high, imagine those end organs are like balloons. They will burst. And that's why you have stroke in the brain, you have blindness in the eyes, you have heart attacks in the heart, and you have kidney failure where people go out dialysis in the kidneys. Things that make the pressure high are varied. Hereditary is a very strong factor. And that's why when people have it, it never goes away. There is no cure to high blood pressure. Diabetes, on the other hand, is a sugar breakdown and utilization problem in the body. We eat sugar every day in almost everything we eat. Most of our starches and carbohydrates are high in sugar by the time the body breaks them down. We are a culture that loves starches. Rice, gari, pounded yam, amala, all the swallow family, spaghetti, noodles, the list goes on, yams. We do have a staple diet that is mostly comprised of starches.
Now, of course, there's nothing wrong with this.
There's nothing wrong with it, but this is where the problem comes. If you can imagine a car with a tank, you cannot put more than what that tank will take in that car. There is a full limit. And the car cannot use more than the amount that you've put in it. Even if you had a reserve tank in the car, it would stay in that place until you are in need of it. But the body, unfortunately, doesn't have that gauge that makes people stop. If we had that gauge in our body that stops food from going down when you're full, a lot of people will be healthier. But you keep eating and you keep eating, you eat more than the portion. The tank size is the portion the car can handle. We have portions that we're supposed to be able to handle. But because we are the way we are, we do not respond to the brain's signal that says you are full. If you pay attention hypertension when you're eating, you will notice a point will come when you feel full and satisfied. But we never stop there. We always go beyond that. Now, when we get to the point of excesses, the body doesn't know how to handle those excesses. And it's those excesses that now cause problems in the way the body runs itself through the course of the day. So the blood sugar tends to be higher when you go over the limit of the serving you're supposed to consume. So what does the body do with it? It tries to convert it to other things like fat and stuff in the body. The fat gets to a limit where the body doesn't know what to do with it. The organ that works to run this machine that breaks sugar down, that breaks the carbohydrates down, is called the pancreas. The pancreas is a machine that can be worn out. It's like a machine in the body that can be worn out. And when you overuse it, when it overstimulates and overworks in the process of the excesses you're eating and is trying to make you healthy, it breaks down. And when it breaks down, your body cannot utilize sugar. No matter how much of it you take, it's not going to turn it into energy. It's not going to turn it into fats. It's going to go into the heart and parts of the body and cause disease.
So that's how diabetes comes about.
And that's how diabetes comes about.
Okay, but some people would tell you that, okay, I take sugar and, I don't have diabetes.
Because we have a hereditary component to that too. Some people can drink alcohol like a fish and smoke like a chimney and just have the most unhealthy lifestyle. If it is not in their genes to have that disease, the hypertension and diabetes, chances are they will not. And that's why it's not good to compare yourself to somebody else, because you really don't know what your genetic composition is. And it can skip generations too. And you may be the unlucky one that would have the genetic inheritance of having the diabetes and high blood pressure, and a little bit of alcohol, a little bit of cigarette, a little bit of overeating, a little bit of sedentary lifestyle will tip you over into a hypertensive or diabetic state.
Okay, so all of those will be some of the risk factors, for this. What's the relationship between hypertension and diabetes?
The relationship is in a way that the stressors that contribute to these diseases are common. The predisposing factors: overweight, alcohol, excessive intake, a sedentary lifestyle, not exercising, a lot of salt for hypertension, a lot of sugar for diabetes, and when you carry these two along, it's like you're buying two things for the price of one, because both of them are often precipitated by these conditions. So if you have the genes for one or the other or both, and you have these factors in your life, you will be bringing the two together in your lifestyle.
Okay, so one can bring the other on, right?
Not necessarily, but that the two travel on the same road. And if you are prone to traveling that road, you will carry the two with you as your passengers, because they live on the same, they hang out together in the same area. So if you have the genes for them, if you have those kind of lifestyle, chances are you will eventually get the two. And the third one, which is the cholesterol problem, which is not often talked about because it's not as common, can be inherited and be a disease that would accompany the other two.
Okay, now let's talk about some of the signs, for hypertension, for diabetes. What are some of the signs?
For diabetes, they call it the sugar disease, because you actually urinate sugar. And when in our culture and environment where we don't have a lot of technology around the corner that we can use, the commonest thing is for people when they notice ants around their urine. When you have ants around your urine, chances are you are diabetic. But aside from that, people will have headaches, they will get dizzy. There's what we call polyphagia, where there's excessive thirst. There's, for no reason, you just keep drinking and drinking and drinking all day. There's polyuria, which is excessive urination. The person just keeps going to the bathroom. There is polyuria, polydipsia, polyphagia. Polydipsia is excessive thirst, and polyphagia is excessive hunger. You keep wanting to eat, you keep getting hungry, and all of these is associated with a weakness, sometimes headache, blurry vision. The person will feel sick, the person will feel ill. But I don't know of any new onset diabetic that didn't feel really sick enough to go and get help from the doctor. But with the high blood pressure, the silent killer, people don't typically feel that ill. Vague headaches every now and then. That's the most common symptom. A headache that won't go away, headache that will not respond to Panadol, headache that just defies everything. Even when you go to bed and you wake up, it comes back again. If you're having incessant headaches, you need to go and get your blood pressure checked. Blurry vision is one of the other symptoms that you have in hypertension. Chest pain can be a feature when the heart is compromised. When there's a weakness in one limb, one arm is a symbol of the brain being involved. Sometimes kidneys can be involved too, but most of the time, dizziness, headaches, tiredness are often signs of hypertension.
Okay, like we have on the screen right now, there's a pregnant woman getting checked for blood pressure. What would be the normal range and, the one that it's gone above board?
Normal range of blood pressure has been changing over the years, but it depends on who you ask. If you ask a family physician, they will tell you 140 over 90. If you ask a cardiologist, they'll probably tell you 130 over 80. If you look at some textbooks, they will tell you 120 over 80. Now, the way I like to explain this is there's something called a baseline blood pressure. Your body is different from mine, is different from the next person. Your heart rate tends to run at a certain range, so does your blood pressure. So that's why it's good to get a routine check yearly. Every year go for your physical, because when you do, you know what your normal blood pressure is. So when it rises, then you know that you are having problem with your blood pressure. A range, I prefer to define it in terms of the increase from your baseline. But if you don't know your baseline, any number over 140 over 90, it needs to be on medication. 130 over 80 may be monitored. You can go into lifestyle modifications and changes, but it's always good to know what your baseline is. If you're 60, if you're 90 over 60 and you become 120 over 90, that may be a problem for you because you have jumped about 30 points in your blood pressure. But when you go to see a doctor, you're 120 over 90, the doctor may think you're normal, but not understanding that there has been an increase in your baseline blood pressure.
Okay, and it's really very important to go for the screening.
It is extremely important to go for the screening, not just the screening. This screening is not supposed to be the order of the day. It is an exception to the rule because we're not a culture that seek preventive health. We're trying to bring awareness to people to know that you shouldn't wait till you're sick before you see the doctor. The doctor is meant to keep you from not getting sick. Go in and get checked yearly, but with what Lagos State is doing with the statewide hypertension and diabetes screening is in every local government and local council development area, we have a primary health center that is doing the screening starting next week, Tuesday till Friday, and then the next upper Monday. And it's from 8 o'clock in the morning till 5 o'clock in the evening. You will have your blood pressure checked, your weight and height measured, your basal mass, your body mass index measured, your blood sugar measured, your blood pressure measured. You will be counseled, and we have a follow-up on the patient, the visitors to the hypertensive or diabetic or hypertensive and diabetic. We have a referral system in place to triage and follow through, see that the ones that are mild go to primary health care system, the moderate to the severe patients go to the general hospitals, and vice versa. If the ones at the general hospital get better, they are sent into the primary healthcare system. So we want people to come out and utilize this facility to sensitize them to the possibility of what their body may be doing in terms of their hypertension or diabetes predisposition.
Okay, I think we'll just take a quick break now, and when we come back, we'll be talking more about hypertension and diabetes, of course, the prevention and screening, which is very important. Just stay with us on Health Matters.
An absent father and breadwinner.
This is 5 years and 6 months. My husband been in China jail. I'm suffering. The only thing remains for me is to go to streets and beg money.
A mother in search of a loved son. 3 different families, bound by one story. Find out why these women want their loved ones in Chinese jails returned home to do their time, and get a first-hand account of life in a Chinese jail.
I spent 4 years, 7 months. Once in a year, I went to court.
Jailed in China, a special investigative piece by Deji Badimosi, coming soon on Channels Television.
You're watching Health Matters, and you can join us in this discussion. If you have any question, you have your comments, you want to ask the doctor here any question at all, you can call us on 018923 Again, 018923 Doctor, in all of this that we're talking about, we've not mentioned children. Does it mean children don't have hypertension or diabetes?
Children do get hypertension, but it's rare, and theirs is often secondary to some congenital, that is a condition that they were born with. Most of the time it can be caught. Again, it's through routine physical. Blood pressure doesn't typically just appear out of nowhere. It tends to ride up and down till it sets and it becomes a medical condition. So it is very important, whether it's a baby, whether it's a child, whether it's an adolescent, adult, elderly, make a habit of having your baseline measurements known, and that is only through going for yearly physical. It is very important. I cannot overemphasize this, that we need to start becoming a culture that maintains everything we put our hands on, including our own bodies. We need to learn to maintain our bodies, we maintain our cars, our buildings. Just maintenance culture needs to be part of what we must imbibe or inculcate into our daily habits.
Okay, I think we have a caller now. Yeah. Hello.
Hello.
Good afternoon.
Yeah, good afternoon.
Please go ahead with your question or comment.
Okay, yes, my name is Emmanuel. I'm calling from my job.
Okay. Good morning.
So good morning, please. Well done for the good job you're doing. I want to ask the personal assistant to the governor. So first.
Go ahead.
Okay, ma'am. Please, ma'am. All this is like using bitters and coal. Most of this will buy. But they reduce sugar, excess of sugar in one's body.
Okay, thank you, Emmanuel. He wants to know whether all these bitters actually reduces sugar.
Well, without mentioning any specific brand,
no.
There is no scientific proof that any of these alternative medical conditions, medical medications or I don't want to say concoctions, do cure blood pressure. Not even the conventional medicines cure high blood pressure or diabetes. They are lifelong illnesses. They don't go away. If you're feeling better, it's because your medication is working. It doesn't mean it's time to stop them. They are lifetime. So if you take any concoction and you feel better, I don't know what to tell you except that they're not recommended. A lot of them have high mercuric or metal contents. A lot of them are unmeasured. The reason why we're confident to dispense medications is because they're measured. They've been tested. Their complications and side effects are known. And when you're taking something else, we can always tell whether those things agree with your body. A lot of us die from these complications because we're now coming to the hospital after we've been taking concoctions when the condition gets worse. And then we're given conventional medicine, not knowing what you've been taking, and then the patient dies, and then it becomes the problem of the hospital.
Okay, so they're not recommended.
They are not recommended.
All right, let's see if we have another caller. Hello.
Hello. Yeah, good afternoon.
Could you please turn down the volume of your TV set?
Yeah, I'm doing so. Hello.
Go ahead,
Is it
please.
okay now?
Go ahead.
I want to find out from the doctor if diabetes is curable.
Okay. Abraham, okay, thank you for calling.
Thank you. Well, again, it is not curable. Diabetes is not curable. High blood pressure is not curable. You can control it. It can get better. You can actually control it to the point where your numbers are like the numbers of someone that don't have the disease, which means that your life expectancy becomes like those that don't have the disease. That is the whole essence of you going for routine checkups. When you're diagnosed, follow your doctor's instructions. They tell you to come back in 2 weeks. Please go back in 2 weeks. They tell you to come back in 3 months. Please go back in 3 months. And if they tell you, your doctor should tell you what to look out for that should bring you in sooner than your next appointment. There's a reason why doctors do these things. It's not because they want to take your money or they want to make your life uncomfortable because you have to leave work to go for your follow-up. But follow-ups are very important when you have a chronic disease. That's what high blood pressure and diabetes are. They're chronic diseases. They do not go away.
Okay, now, when is the best time to check this blood pressure, for instance?
Well, people say before you get out of bed because you have been sleeping, your body's been in a state of rest. And ideally, before you get out of bed is when you should put on the sphygmomanometer and check your blood pressure. And for breakfast, for diabetes or for sugars, before you eat in the morning, so you know your fasting blood sugar is the baseline blood sugar. If those numbers are fine, chances are when you wake up and you start getting the harassment of the day and your blood pressure starts going up and down, your baseline is there to guide the body in where to start and stop. But if your baseline was high at the onset of the day and you add more to it, then it becomes a problem as the day goes on because you cannot handle too much stress through the course of the day. You can take your blood pressure any time of the day. Again, if you're hypertensive, I often recommend to my patients to take their blood pressure different times of the day because it gives me a better indication of what their blood pressure is doing throughout the course of the day. When you wake up, when you get to work, when you're at work, when you're leaving, when you get home, that way I can have a panoramic view of how you're doing. What time of the day do you need the most control of your blood pressure? Again, for sugar, if you eat, the best time to check your sugar after eating is 2 hours. It's called the 2-hour postprandial blood check, and that's when your body should have wiped out the blood sugar you consumed. So if after 2 hours you have a lot of blood still floating, a lot of sugar still floating around in your blood, then there is a problem and you must see your doctor.
Okay, so for those who will be going out for this screening in local government areas and local council development areas,
the 57.
Are they paying anything?
No, it is all free. It is all free. Nobody should be paying for the screening or the medications that will be given. The hypertensives that are really moderate to severe will be started on medication. They will be given pills to take so they are able to follow up with the doctors. That is, if we're not taking them immediately to the hospital. There are ambulances on standby to take severe cases, those that are really like prone to getting a stroke any minute. We will transfer them by ambulance to our general hospitals. If you don't have to come in fasting. Our counselors will ask you when last you ate or you drank, and that we can use to calculate what your sugar should be, so you don't have to starve yourself when you're coming in. If you just ate, we know what range your sugar should be. If you ate within an hour, 2 hours, and so on, until you have at least the 8 hours required of the fasting.
Okay. Yeah. Thank you so much for coming.
Thanks for having me.
Thank you.
Thanks.
And I'd like to thank everyone watching at home, Emmanuel from Aja and Abraham also who called in. Thank you all for being with us. Let's do this again next week. I'm Yomi Otaigbe.